Good afternoon, this is Dr. Do again. This video is still on alphabetic list of problems on the letter C. Today I'm going to talk about the coughing, particularly chronic coughing. Before I talk about the mechanisms or the diseases that might cause the chronic coughing, I like to start with what kind of chronic coughing can be managed at home, or what kind of chronic coughing becomes serious and need to visit the emergency room. So if you have chronic coughing long term, either you have a history of asthma, or you recently upper respiratory tract infection, or any chronic lung disease like COPD. So these are all can cause the chronic coughing. But like we talked previously, if the coughing is accompanied by the fever, chest pain, hypoxia, or the chronic bronchitis, coughing up a lot of mucus, profound production of mucus, if that mucus is changing color associated with the fever, like a greenish, yellowish, very thick, or it's hard to cough up associated with the fever. So these kind of conditions, some of them you need to at least talk to your physician, discuss with them. Or if you really feel the sputum is very thick, it's hard to cough up, that is very dangerous to cause the hypoxia and also the respiratory distress. So if that's the case, go to the emergency room. They will give you some medication or fluid, rehydrate, and also to liquefy of the sputum so you can cough up or to suck it out. So these are the situations. Anything impair the airway, impair the breathing, or high fever cannot bring down all the. These are the life-threatening situation. You need to go to the emergency room. Other than that, all the chronic coughing, I think the first-hand management should go see your physician before you manage at home. Can you manage at home? You can after exclusively diagnose, after exclude any organic cause, any medical diseases, then just so you can use some medications, or your doctor prescribe you PR and use medications so you can manage at home. And unless it's getting worse, you visit doctor again, go to the emergency room. Okay, so let's talk about those are the situation when you need to go to the emergency, when you can manage at home, and majority of the case you need to talk to your physician first before you decide to manage at home. Has to be exclusive of all the medical causes, and majority of the case PR medication or over-the-counter medication after. Make sure you do not have any medical conditions. So this is a in general idea. And coughing, let's talk one by one. First of all, let's talk about the mechanism of coughing. Actually, coughing is one of the defensive mechanism of the respiratory system, which means it's good. Because the mucus production or local inflammation causes mucus production. And if it's not coughed up, accumulated, particularly if accumulated in the low respiratory tract, the mucus, the sputum, is a very good culture media for bacteria. So if those mucus accumulate in the lung or bronchi, that will complicated by the bacterial infection, which will make the viral caused upper respiratory tract infection becomes bacterial cause, which is more serious, has to be treated with antibiotics. So regardless, any if you have the coughing, feel some mucus, and may or may not have fever, just probably simple upper respiratory tract infection, at the beginning, do not use the suppressant of coughing unless it is a dry coughing. It's a different story. If it is a dry coughing, then it's because the constriction of the bronchi, and you feel irritated, hard to sleep at night. If that's the case, you can use it. Use the over-the-counter cough suppressant. But other than that, if there's a mucus, then don't suppress it. Just let it out. to prevent complicated bacterial infection. So this is the mechanism, because our respiratory tract has a little filament structure lining on the internal endothelial cells. So it's like a mop sweeping out of the mucus and roll it out, so which decrease the chance of bacterial infection, which is a good defense mechanism. So what are the causes of the chronic coughing? Chronic coughing usually can cause COPD is one of the most common cause, chronic bronchitis, emphysema, asthma, and also the post upper respiratory tract infection, because the especially if this upper respiratory tract infection accompanied by the fever, even though it's not bacteria, but the inflammation itself can last a little longer. Even though you feel better, you do not feel sick, but still can have the coughing. The local inflammation still irritate the bronchi. And the sinusitis also can cause coughing, because the congestion reflectively to irritate the bronchi. So that is the other cause of chronic coughing. For the older people, there's a different story. If you're older than 50 years old, especially if you have a smoking history, without known cause of without COPD, without bronchitis, without asthma, but just a long, dry coughing, that's, I think we already talked about the lung cancer. That's probably a risk factor for the for lung cancer. So you need to see your physician to check it out. There's another disease, bronchiectasis. It's the bronchioles or the alveoli dilated. So that's another case, can cause chronic coughing. It's not quite common, but it could. And this disease usually accompanied by the pink, either pink sputum. So this is another condition can cause chronic coughing. Wrapping it up, really chronic coughing is kind of, even though may not very serious, but if it's a long-term going, really impact the daily life, couldn't sleep well, couldn't function well. If that's the case, seek medical attention. Use some medications if it is post-infection, probably complicated by the bacterial infection. So then doctor will prescribe you antibiotics, or just the bronchi constriction irritated. So that if that's the case, use a bronchodilator to PRN based to relieve the coughing and irritation. So this is about the chronic coughing. Actually, this chronic coughing, if in the medical field, if you talk to the professionals, it's a long talk. It's a long list of causes, long list of workups. But since this is not, this video is not for those people, just for the general people, for patients. So this, I just briefly summarize the causes and the emergency and also the manage at home. How can you manage at home, and want to see your physician. It's a very touch bases and superficial, and I hope it helps. Thank you for watching, and I will see you next time.